Clear! Good day everyone. So today, we will talk about English for medical purposes. So what is English for medical purposes? So the term English for medical purposes or EMP refers to the teaching of English for doctors, nurses, and other personnel in the medical professions. So English for medical purposes is a subgroup of English for specific purposes, and it has its own subgroups as well. So the need to communicate about health issues is not restricted to hospital workers, and so a wide range of EMP courses and texts are needed to cover every specialized medical English language. So English for medical purposes is a branch of ESP or English for specific purposes. So ESP has developed into an umbrella group of courses for specific areas of learning or for specific professions, as it was recognized that even high levels of competency in general academic language do not prepare workers in specific professions. That's why ESP was born. So the English for medical purposes covers the English language which healthcare professionals need to be able to practice safely and confidently. Learning English is essential for medical professionals and necessary for their training and upcoming medical careers because all medical information for medical professionals is available in English language, and most international conferences and congresses are presented in English. So English language is necessary for medical professionals as most of information are presented in books, articles, documents, and journals are in English language. So the English for medical purposes or EMP became essential. So English for medical purposes is a kind of English for specific purposes or ESP, which is important for academic and professional needs of medical students.
International borders are becoming more accessible for working professionals, especially for experts in the healthcare field. The importance of English is also significantly increasing. English has become one of the most common language of communication across nations in all scientific fields, including the field of medical science and healthcare. Globalization and accelerated exchange of information requires knowledge of a common language for international communication, particularly for special features and the use of terminology in the medical professions. Consequently, it is necessary to acquire reading skills and a good understanding of the medical literature in the English language for progressing in the field of healthcare. To communicate and exchange ideas, beliefs, emotions, and feelings, English is preferred as a common language in the healthcare sector. Healthcare professionals have many reasons to learn English. In the healthcare industry, people's lives are at stake, so any misunderstanding is risky. It is therefore crucial to pay attention to language in fostering a trustful and comprehensible relationship between healthcare staff and both patients and the family members. The choice of words used is highly important to avoid confusions and to calm and ease the mind of the family members. We can conclude that the English is one of the important languages of the healthcare industry. This is the language that connects the professionals, make it possible to transfer the experience, skills, and knowledge, and very important to provide quality care to patients.
So next is I am going to tackle the disorder in learning English, which is the aphasia. Aphasia is a language disorder that makes it hard for you to read, write, and say what you mean to say. Sometimes it makes it hard to understand what other people are saying too. Aphasia is not a disease. It's a symptom of damage to the parts of the brain that control language.
You can understand what I'm saying to you, right?
Yes.
Okay. Can you close your eyes for me? Perfect. Now tell me your name.
Cause I've had no I am.
So there are 6 symptoms to consider that a person has an aphasia. First, have a trouble in speaking clearly. Next, have a trouble in understanding speech. Next, have a trouble in writing clearly. Next, have a trouble in understanding written words. Next, have a trouble in remembering words. Last, have a trouble in remembering object names. Next are the causes of aphasia. First is stroke, the most common cause of aphasia. Next, severe head injury. Next, a brain tumor. Next, progressive neurological conditions or conditions that cause the brain and nervous system to become damaged over time, like dementia. As you observe, aphasia is really a disturbing disorder because it leaves a person unable to communicate effectively with others.
The producer asked us to count to 10. Remember that?
Yes.
Can you do that again?
Why? 1, 2, 3, 4, 5, 7. Going to Gabby people. Go. I can't.
No, that's really hard. Let me get you started.
I was stunned.
Okay.
The recommended treatment for aphasia is usually speech and language therapy. This treatment is carried out by a speech and language therapist or SLT, and sometimes aphasia improves on its own without treatment. So there are 3 types of aphasia. First is the Wernicke's aphasia, the most common type of fluent aphasia. People with Wernicke's aphasia may speak in long, complete sentences that have no meaning, adding unnecessary words, and even creating made-up words. As a result, it is often difficult to follow what the person is trying to say. People with Wernicke's aphasia are often unaware of their spoken mistakes. Another example of this type of aphasia is difficulty in understanding speech. Second is Broca's aphasia. People with Broca's aphasia have damage that primarily affects the frontal lobe of the brain. They often have right-sided weakness or paralysis of the arm and leg because the frontal lobe is also important for motor movements. People with Broca's aphasia may understand speech and know what they want to say, but they frequently speak in short phrases that are produced with great effort. They often omit small words such as is, and the. People with Broca's aphasia typically understand the speech of others fairly well. Because of this, they are often aware of their difficulties and can become easily frustrated. Last, global aphasia results from damage to extensive portions of the language areas of the brain. Individuals with global aphasia have severe communication difficulties and may be extremely limited in their ability to speak or comprehend language. They may be unable to say even a few words or may repeat the same words or phrases over and over again. They may have trouble understanding even simple words and sentences. There are other types of aphasia, each of which results from damage to different language areas in the brain. Some people may have difficulty repeating words and sentences even though they understand them and can speak fluently, which is conduction aphasia. Others may have difficulty naming objects even though they know what the object is and what it may be used for, which is called anomic aphasia. Not all affected by aphasia require treatment. If the brain damage is mild, a person may regain all their previous language skills without treatment. However, most people undergo speech and language therapy. This helps to rehabilitate their language skills and supplement their communication experiences.
English for medical purposes, or EMP, became essential. EMP is a kind of English for a specific purpose, or ESP, which is important for academic and professional needs of medical students. There are similar reasons for medical professionals to learn medical English, as it has gained nowadays status of lingua franca. Medical practitioners, or those who help the sick, use medical abbreviations as a shorthand in their writing and speaking to expedite the explanation of diseases, patients, or medications. Words with meaning are also made by medical practitioners. The word stat is an illustration of this. used to suggest or prove that something needs to be hurried or done more quickly. It derives from the quick-sounding Latin-based word statim. On other forms of patience, shortening text is a very common or often used shortcut. As an illustration, the term pre-op refers to patient who is getting ready for surgery. Longer illness names can be condensed or made less wordy, using the shorthand by removing all but the Latin or Greek roots from the word. Words with meaning are also made by medical practitioners. The word stat is an illustration of this, used to suggest or prove that something needs to be hurried or done more quickly. It derives from the quick-sounding Latin-based word statin. In other forms of patience, shortening text is a very common or often used shortcut. As an illustration, the term pre-op refers to a patient who is getting ready for surgery. Abbreviations on how to take a medicine. Since medication can be given in different ways or routes, abbreviation for the most common routes are abbreviation PO, means the medication is taken by mouth or swallow. The next one is the IV, means the medication is taken intravenously or injected into a vein. Abbreviations on when to take medication. Doctors use many different abbreviations to say when to take a medication. It is helpful to remember that doctors use the letter Q to stand for every. For example, QAM stands for every AM or morning. Abbreviations QPM, this means the medicine should be taken every evening, and the QHS, this means the medicine should be taken at bedtime. Abbreviation about the body. Common abbreviations that have to do with the human body include abbreviation BP stands for blood pressure, that means a measure of how hard the heart is working. The next one is the HR stands for heart rate, that means how many times the heart beats in 1 minute. The next one is the O2 or oxygen, that pronounced as O2. The next one is the O2 sats, means oxygen saturation, a measure of how much oxygen a person is getting. Abbreviation RBC stands for red blood cells, that means the cells in the blood that carry oxygen. The next one is the RR, stands for respiratory rate, that means how many times a person breathes in 1 minute. The next one is the VS, that stands for vital signs, means a patient's blood pressure, heart rate, respiratory rate, and temperature. The next one is the WBC, stands for white blood cells, that means the cells in the blood that fight infection. The next one is the WNL, stands for within normal limits, that means normal for the patient age and gender. For example, VS WNL means vital signs are normal for this patient.
How to teach medical English in the classroom. Teaching medical English in a classroom can be a challenging task as it requires a specialized vocabulary and a good understanding of medical concepts. However, there are several effective strategies that teachers can use to help their students improve their medical English skills. Number one is to use authentic materials. One of the most effective ways to teach medical English is to use authentic materials such as medical journals, textbooks, and articles. This will expose students to the language and terminology used in the medical field and help them understand how it is used in real-world situations. Number two is role plays and simulations. Role-playing exercises and simulations are a great way to help students practice their medical English skills in a realistic context. This can be done through scenarios such as doctor-patient interactions, medical consultations, or emergency situations. Another one is the vocabulary and terminology. It is essential to teach students the specific medical vocabulary and terminology used in the medical field. Create a glossary of key medical terms that students can refer to throughout the course. Another is to use visuals. Visuals such as diagrams, charts, and videos can help students better understand complex medical concepts. Use them to supplement your lessons and engage your students. Another one is pair and group work. Pairing or grouping students with different levels of medical English proficiency can encourage collaboration and help students learn from one another. Another one is to incorporate technology. Technology can be an effective tool for teaching medical English. There are many apps and online resources available that can help students improve their medical English skills. Another one is to assess and give feedback. It is important to regularly assess students' progress and provide feedback on their medical English skills. This will help them identify areas where they need improvement and work towards improving them. By incorporating these strategies into your classroom, you can help your students improve their medical English skills and prepare them for a successful career in the medical field.
What seems to be the problem? I think I'm gonna put the food out of me. Throw up. Sorry, I feel like I'm going to pass out. Oh, what should I do now? Well, you should rest for some days and take this medicine every 8 hours. And here's your prescription.
Hi guys, here are some clips of our elderly female body, aka Viv, being intubated. As you can see, we have the lovely Dominique working on her, and in a second you'll see her breathing. Every single one of our bodies is checked by someone before leaving the building to make sure that they are completely intubatable, that they're breathing all right, that we can bag them. We make sure to check every single medical addition that we put onto these bodies before releasing them to their new homes. If you have any questions, or if you're a medical professional, please duet this. We really want to hear from you guys on what you think.